This is Jose Martino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Welcome to this episode of the Neurology podcast. My name's Jon Stone. I'm a neurologist in Edinburgh in the UK, and I'm really delighted to have with me today Davide Martino and Tamara Pringsheim to give us an update on where we are with functional tic-like behaviours, functional tics. I did a podcast with Tamara just over a year ago, and since then there's been a lot of activity, information. Many of you may have seen an article from the New York Times a couple of months ago in February 23 talking about what's happening with functional tics. So, Davide, Tamara, welcome to this podcast.
Thank you.
Thank you.
Maybe we could just start by letting us know a bit about yourselves and the roles that you have.
Davide Martino, I'm a professor in neurology at the University of Calgary, and I am also the director of the Adult Movement Disorders program.
Great. And Tamara?
I'm Tamara Pringsheim. I'm a professor of neurology at the University of Calgary. I run the Tourette Syndrome Clinic at the Children's Hospital, and I also see adults with Tourette Syndrome Clinic at our Movement Disorders Clinic.
We're going to cover a few different things today. We want to talk about the topic of the New York Times article, which was really sort of suggesting that maybe a lot of patients with functional tics had improved and perhaps the problem's going away. But things are never that simple. And both of you have been involved in some really helpful, important papers, I think, looking at the clinical details of patients with functional tic-like behavior and also suggesting new diagnostic criteria for them. So we're going to cover all that. But I wonder if we could start with just a recap here for those who've perhaps not up to date with this story. What's happened with functional tics in the last few years? Because those of us that were involved in tics and movement disorders and functional disorders saw the occasional patient with functional tics, but something unusual happened in the last few years.
Things started to change in the fall of 2020. We were in the midst of the COVID-19 pandemic, and simply we started experiencing the admission of patients with a very abrupt and almost explosive outburst of repetitive behaviors that really looked like complex tics. Admission to emergency departments or very fast, streamlined referrals to our movement disorders and Tourette clinic. And we started observing this, as I mentioned, for the first time around October 2020, but then they started trickling in for the following couple of months, and then really the situation exploded a bit the first couple of months of 2021, to the point that our ratio between traditional primary tic disorders and these rapid onset tic behaviors in terms of new referrals came almost reversed. I mean, we were seeing almost more new patients that we were labeling as functional compared to primary tic disorders, whereas in the past, really, the functional patients really explained or less than 5% of our, if not even less, 3% of our new referral population. And we started chatting, obviously, with our colleagues around the world who see patients, primarily patients with Tourette, and have an interest in that. And we just realized very quickly that this was something that was happening really around the world and not just in our center. And then there was an editorial published from London, from Tammy Hatterley and Isabel Heyman, was probably the first publication that highlighted this. And it became very clear that we needed to compare our experiences and trying to figure out what was going on.
And I think you've put together this paper, which appeared in the European Journal of Neurology, from your international registry, from all these colleagues around the world. Tamara, I don't know if do you want to come in here and just tell us a bit about that collaboration and where that now sits in terms of the data that we have on these patients?
Yeah, so people had been publishing their individual case series from different centers, and we thought it would be useful to have the information all together and to perform some common analyses. And so Davide led the development of this international registry where we were able to describe several hundred patients who developed functional tic-like behaviors from 2019 and describe the common characteristics seen in this sample.
So this is now really the largest sample, isn't it? The largest group of, sort of clinical description in terms of what we've known, what we've learned about this type of movement disorder.
Yes, there's almost 300 patients in the international registry that were included.
Whereas I think before the pandemic, I think there was just 2 or maybe 3 small case series of 10 or 20 patients.
That's right.
Which gives some idea of the difference in terms of the numbers. So a lot of patients. I mean, some people have talked about a sort of epidemic. Do you think that is a useful word, or is that exaggerating it in terms of the overall numbers that people have seen around the world?
I don't think it's an exaggeration, because since that time, a number of papers, population-based studies in both the United Kingdom and the United States have actually documented a rise in visits to general practitioners and emergency rooms for tics, and specifically tics in teenage girls. So we know that it occurred widely across populations. So it's not just something that was seen in specialty centers. It was seen in the general population.
So you think there's a lot of patients out there with tics not making it into these specialist clinics?
I think that we only saw the tip of the iceberg.
Yeah, interesting. One of the reasons this became so well known was the media got hold of this concept that social media had potentially been a powerful factor in this explosion of new cases, and then acquired this name TikTok tics. Perhaps I can ask your thoughts on that now that we're a few years into it. What do you think about the role of social media? Should we be calling them TikTok tics?
Certainly, we're looking for catchy denominations, and personally, I'm not a great fan of catchy denominations in medicine. But certainly, what we have observed is there was a significant proportion of these young people who manifested complex tics that could be related almost in a sort of a modeling scheme to tic behaviors. I think we could probably call them tics just to make it simpler and faster, but tics that were exhibited by highly popular influencers on different social media. Not just TikTok, obviously. I think it's obviously focusing on TikTok because it's important and because it sounds like tics, but actually probably some of the most interesting videos from these influencers were actually published on YouTube and other social media channels too. So there was certainly, for a proportion of these patients, a modeling scheme that was happening. Some of these complex vocalizations have really kind of made the news for how commonly spread they were in an unprecedented way, like the word beans, or there are other examples of behaviors that appeared very context appropriate sometimes, which is not a characteristic of primary tics. And it was actually talking to Tamara talking to a member of her family, a daughter who was obviously more acquainted than us on what was going on in the social media world, and realized that we actually found some of these influencers. And then there was also a homologue, if you will, in the German world, in the Germanophonic world, who had been active even before the pandemic, and which led also to some important commentaries on this by Kirsten Müller-Wahl's team in Hanover. So it is certainly true that there is a modeling element in the proportion of these patients. Whether that explains at all, obviously, it is quite unlikely that this is the explanation for the phenomenon that we have observed. I also think that the time period is quite important, and the effects of the pandemic were temporally coinciding with the explosion of these social media influencers. They were happening at the same time, probably facilitated by the different use of social media that occurred during the pandemic.
If I might add that, one thing that's really striking me now is that currently there seems to be an increase in social media sort of chatter about borderline personality disorder, autism, and ADHD. And now many of my patients who originally presented with tics, their tics have remitted, and now they're seeking diagnoses of ADHD, autism, or borderline personality. So it seems that, there are trends on TikTok, and certain things rise and fall in popularity. And I found that the clinical presentations I'm seeing are sort of paralleling the rise and fall of trends on social media.
So I know that patients themselves, I think this is probably an important point, are very unhappy with the idea of TikTok tics, both patients with functional tics, because it tends to suggest, well, you've just been looking at social media too much, just stop it. And also, I know that a lot of patients with Tourette syndrome, particularly girls with Tourette syndrome, were being told that they had Tourette's because they were looking at social media too much. So it's had quite a lot of adverse consequences for patients as well. I don't know if you found that, and we should probably try and avoid talking about TikTok tics. Is my personal view.
I think that it's gone both ways. In some people, they found that when they decreased their exposure to such stimuli, that their problems improved greatly. Some of my patients were very forthcoming about the fact that, they'd spent the entire night watching these videos and came down with symptoms the next day. And some of them, even before meeting with us, realized that this was triggering their own behaviors and deleted the app from their phone. So I think it really depends on how open someone is to the possibility that they are being socially influenced. We are social creatures. Our behavior is affected by the behavior of people around us. We are impressionable. And I think that the acceptance level of this fact differs from person to person.
Makes sense. And you said there, Tamara, how so many of your patients, tics have improved and now they're talking about other things. What are your thoughts about the frequency of functional tics now compared to, say, a year ago, 18 months ago?
It's definitely come down. As Davide mentioned, there was a time, I'd say, for most of the second half of 2021 and the first half of 2022, in my clinic, we see 6 new patients a week. And easily 5 out of 6 of those patients were patients with functional tics. And now probably I'm seeing maybe 1 new patient a week with functional tics. And again, most of my patients have Tourette syndrome. It hasn't come down to the proportion of functional tics that we saw prior to the pandemic, but it's dropped significantly. That could be because now the pediatricians are aware of functional tics and they're not referring them. I think that that's possible. But I also think that it's naturally just improving. Most of our patients are improving, not all. There are some that continue to have functional tics, but we just performed an analysis of our data of a prospective follow-up of patients, of more than 80 patients over 12 months. And there's a major decrease in the number of tics patients have, the frequency and severity of their tics, and tic-related impairment over time. So we know that patients are recovering from this.
That mirrors my experience here in Scotland as well. I think there has been a gradual decrease as well. As you say, it's still there more than it used to be.
Yes. I found that some of my most severe patients are now developing other neurological or psychiatric symptoms or questioning other neurological or psychiatric diagnoses. I've had a number of patients develop functional seizures, some functional fainting spells, functional paralysis, and then again, a number seeing psychiatrists for questioning diagnosis of autism, ADHD, or borderline personality.
Well, let's talk a bit about that, because the link with other FND symptoms was pretty clear early on, wasn't it? That was one of the things that these patients had in common. Mm-hmm. But I think all of us working in the field of FND are becoming more and more aware of this sort of autism, ADHD, borderline personality, or emotional instability, it's sometimes called, personality traits. And as you say, that what's happening is they're becoming something that people actually are actively seeking. We have to be careful here, don't we? Because we've got 3 neurologists talking about this, but you, as tic experts, would be very familiar with neurodevelopmental issues as well. What do you think about some people I'm talking to are feeling that perhaps rates of autism spectrum disorder are actually very high in this group, and perhaps in FND generally?
Yes, I believe we generally agree with this statement. I also think that as everything, we need to be very accurate in the way we screen and assess for these comorbidities. And so some centers might have observed this more clearly also for the characteristics of their assessment procedures, and others might have not captured this as profoundly, again, for some discrepancies and differences in the way in which, for example, autism is assessed. But this is definitely what the data seem to show. Whereas in primary tic disorders like Tourette syndrome, ADHD and OCD are by far the most important and in prevalence neurodevelopmental comorbidity. In this population, autism is probably the prominent one. We see certainly less ADHD and OCD than we would see in a population of patients with Tourette syndrome. As far as the awareness of patients about this comorbidity, and I think the very interesting phenomenon that Tamara was alluding to of diagnosis seeking, this is actually seems to be an interesting common trait within this population. And I don't know how much this applies to the overall FND population, but it is certainly a very interesting phenomenon that we are observing, and that probably relates to other psychiatric domains or personality traits.
Do you have any thoughts, either of you, about if there is a real association between autism spectrum and FND and functional tics? Any thoughts about why that might be?
I don't know that it's autism per se versus autistic traits, right?
Yep.
In my clinical assessment of patients, I found that they wouldn't meet the diagnostic criteria for autism as they currently stand, but that a number of these patients had a lot of social anxiety and perhaps, had difficulties forming social relationships with people, as well as an insecure development of self-identity. So I think that the research will head in that direction. We've tried to delve more into this through one of our ongoing research studies, and I think there'll be more to come.
Yeah, no, I agree. And it's difficult, isn't it, when social anxiety overlaps with autism? They do share some common features as well as important differences, yeah. I wonder if we can come on to the second study, also published in the European Journal of Neurology. I think, Tamara, you were lead author on this, and Davide, you were last, which is the opposite to the other study. I found this a really helpful paper because what you've done is you've got together a lot of tic experts, 24 members, did a sort of Delphi process and came up with some diagnostic criteria for functional tics or functional tic-like behaviours. And I wondered if we could just take the listeners through that, because I think there's some really important lessons here about what things that we think are more specific to functional tics and which ones perhaps are less so.
We used a very data-driven approach based on the international registry. It was certainly very helpful, but then also looking at the individual case reports and as well as our own registry here in Calgary, and then comparing it to registry data on patients with Tourette syndrome. And so, we've proposed 3 major criteria that help clinicians differentiate functional tic-like behaviors from tics, and then 2 minor criteria that differ in prevalence between the 2 conditions, but don't differentiate functional tic-like behaviors from tics. And so our major criterion were the age at symptom onset, the rapid evolution of symptoms and phenomenology, and our minor criteria were the comorbidity profile and the presence of other functional neurological symptoms or somatic symptom disorders. Age seemed to be very important. The vast majority of patients with Tourette syndrome and chronic tic disorders present early in life, usually before the age of 10. More than 90% before the age of 10 will have a symptom onset. And this is very different from functional tic-like behaviors where, by and large, patients were 12 years and older. I mean, there were a few that were a little bit younger than that, but again, more than 90% were over the age of 12 at the time they developed symptoms. So we felt that this was a good number to use as a proposed cutoff that was highly suggestive of functional tic-like behaviors.
Presumably, it's very rare for you to meet someone whose Tourette syndrome has genuinely started after the age of 12.
We have a tic disorders registry in children here. We have almost 300 patients in our registry, and more than 90% report a symptom onset before the age of 12. And usually, the mean onset is at the age of 6, right? So it's considerably lower. And the 95% confidence interval is quite narrow around that onset. not only shown this in our registry that we're collecting right now, but also in established registries that were collected many years ago. So there's an international registry by Roger Freeman, which includes several thousand patients with tic disorders. And again, like more than 90% of patients had a symptom onset before the age of 10.
So we've got the age, we've got the rapid onset, which is quite typical of many patients with this, but very unusual for Tourette's.
Exactly.
And then the phenomenology. I'm sure the listeners will want to hear about what are the clinical clues to the actual features of the tics themselves, or tic-like behaviors that we should be looking for.
The most striking clue is the relationship between simple and complex behaviors, which is, again, temporarily almost reversed in this population. In Tourette syndrome, kids go through a phase in which they predominantly manifest simple tics, both motor and vocal and phonic. Typically, the motor start earlier than the phonic, a little bit earlier. But they maintain this simple nature of very limited number of muscles being involved. There are small movements. And then further on in their natural history, some complex behaviors that share the same basic characteristics of the simple tics, suppressibility, the association with the premonitory urges, they ensue. In this population of functional tics, what we found was, what was observed is that these complex behaviors were essentially present since the offset. As soon as these behaviors started, they had a degree of complexity that was unprecedented in the field of tics. And they were both movements and complex, elaborate vocalizations, which were not so much meaningless sounds, mostly produced by the upper respiratory tract, like sniffing or throat clearing and so on, but really linguistic, verbal tics, fragments of language, meaningless alliteration of sounds and syllables, or words that seemed, in many cases, nonsensical as well, which is also quite unusual in the field of Tourette. The motor complex tics were quite violent and quite ballistic in their phenomenology, and sometimes even implied an interaction with the surrounding environment or themselves, like hitting, for example, or touching or hitting forcefully a surface or another person or oneself was pretty commonly observed in these patients, and pretty much from the get-go or very soon. So this is one of the keys of the phenomenological differences between primary tic disorders and these functional tics is really along the dimension of the complexity and how representative complex tics are of this particular diagnosis.
So higher complexity, lots of words and statements, not just vocalizations. Quite early on, people had been suggesting as well that tics that interfered with normal movement were quite common in functional tics, quite rare in Tourette's. That didn't make the diagnostic criteria in the end, I think.
No, we talked about people having context-dependent tics. So, throwing objects in the direction of people, making statements that seem directed at others or based on the situation. But we didn't talk about it interfering with activities. We did talk about how typically during the neurological exam in the patient with Tourette syndrome, the tics are noticeably less. Like when I'm doing finger nose or eye movements, often in my patients with Tourette's, their tics are completely suppressed. But in this population, that the functional tic-like behaviors were often dramatically worse during the neurological exam.
I mean, it fits with many forms of FND that are states of abnormal focused attention. Obviously, we should emphasize these are involuntary symptoms. People aren't doing this on purpose. But yeah, I think that's a very common feature of other functional movement disorders, isn't it? Mm-hmm. And I also was going to ask about ability to suppress tics, because again, that was a feature that people had said early on, and I wasn't sure about that because I felt I was meeting a lot of people with functional tics who were telling me that they could sometimes suppress their tics in the same way as Tourette's. I was interested that didn't make it in either.
I found that highly variable between patients. It was really about 50-50 for me. About half of them would say, yeah, I can suppress it, and others would say it was completely involuntary. So we didn't feel that it was reliable enough to differentiate tics from functional tics.
And then just moving on, so we've got the major criteria, which really are about the onset and the nature of the tics and the age of the person. It's not about the person themselves or what other medical or psychiatric history they've got, which I think is a very important message. But you did add some minor criteria just to emphasize the importance of looking for that comorbidity.
Yes, it was quite striking, the difference in prevalence of the functional or somatic symptom disorders in this population compared to our patients with Tourette syndrome. And then also just that it seemed that depression and anxiety symptoms, self-harm behaviors, and difficulties with social relationships were the most common comorbidities in this population compared to ADHD and OCD in our Tourette patients.
Great. I thought it was a very nice way of handling that issue. So perhaps we could just finish off with some thoughts about treatment. I mean, you've said a lot of your patients have improved. Do you think that has been the treatment, or do you think that this is often a self-limiting problem anyway? What kind of advice would you give to neurologists out there listening who perhaps don't have access to sort of highly trained tic therapists to help them with their patients in terms of treatment?
Our approach here was to address comorbidity if we could identify a comorbid condition to, if the patient had an underlying anxiety or disorder or major depressive disorder, was to treat this. But we also felt that the functional behavioral intervention and assessment were very important. We needed to understand what the antecedents and consequences of functional tic-like behaviors were for individual patients and to help them to develop coping strategies, and that this certainly was helpful in bringing about resolution. I wonder about also just the influence of time and the resumption of more normal social activities, like what effects those things had as well on patients, just returning to the usual school environment or social activities with the loosening of the pandemic restrictions. Right? As patients became more active and, they were able to do other things, whether that also had an effect.
Tamara, Davide, that was a really fascinating discussion. It's great to hear where we've got to with this field. And thank you very much for your time today. You've been listening to the Neurology podcast with an update on functional tics. Thank you very much.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.